We would be stacking them up kind of like cordwood. You had gurney after gurney just lined up.
COVID-19 still overwhelming New York hospitals and its frontline workers. This afternoon, we're getting an inside look into what the pandemic there looks like from a Boise nurse, Debbie Wilder. She joined the fight against the coronavirus in one of the hardest hit states in the country, and now she is back home and sharing her experience with our Shira Matsuzawa. Shira, what can you tell us?
Tammy, if Debbie's name sounds familiar, well, it's because we've been tracking her journey from the beginning. Our Joe Paris first introduced you to Debbie before she left for New York, and then we shared the moment she returned home with you earlier this week. But now we're getting a glimpse into what her time in New York looked like.
Walk by the semis full of bodies on your way to work. It's a little sobering.
For 6 weeks, Boise nurse Debbie Wilder witnessed sights like this as she made her way to a New York hospital to help frontline workers battle COVID-19.
Emotionally, it really pulls on you.
And inside the hospital, the conditions were just as tough.
ER I was at, you had to squeeze between gurneys of people.
Debbie worked in the ER, helping 8 to 10 patients a day, sometimes more, sometimes less.
You would see people being coded out of the corner of your eye, people who are doing chest compressions. You would run by and somebody would say, "Hey, is this your patient?" And you're like, "No," but they don't have a pulse, so start doing CPR. I had a young man who came in who was barely breathing, and we set up a Skype so he could say goodbye to his wife and his baby. And he was a healthy 31-year-old male.
She says experiences like that would happen on a day-to-day basis.
You never knew how many patients you were going to have. You didn't know where they were because somebody would come and take them for a test and then just plop them where there was a spot. I think this is going to cause some PTSD for everybody that's involved. You just see it in the eyes because that's all you could see of the people you worked with their eyes.
Debbie adds you could see the pain, but everyone would still try and laugh just to get through the day.
Thank you. Thank you. Thank you.
Which is why she would try and lighten the mood when she could. Like here.
What?
When she gave hospital staff members Idaho Spuds.
Your face is bruised and hurts from the PPE. The PPE is not adequate, and you had a face shield and goggles, but it hurt. It's hot, and those folks come back and do it again and again and again. Now, this is real, and I've been a nurse for 28 years. And I have never met anything that scared me as bad as this virus.
Debbie returned to Boise earlier this week to a special homecoming.
Welcome home!
Something much needed after her recent experience. Now, as you can imagine, this can take a toll on a person mentally, physically, and emotionally. And one fallout Debbie says she's seen from all of this is the number of suicides happening. At the end of the day, though, Debbie says she's amazed by the perseverance of the staff there because they keep coming in and doing it day in and day out and still try to smile. Tammy?
Yeah, good for her. And Shira, does Debbie have plans to go back to New York and help out?
As of right now, she doesn't, but she said she would go in a heartbeat.
I bet she would. Thank you, Shira, for bringing us that story.